We are now facing impacts from climate change that are impossible to ignore. We need physicians to understand the impacts of climate change, the causes of climate change, and most importantly, be equipped with the skills and tools to take action to address those. My name's Caleb Dresser. I'm a practicing emergency physician on the Faculty of Emergency Medicine here at Beth Israel Deaconess Medical Center. When I was in my emergency medicine residency training, I cared for patients who were suffering from heat stroke as outdoor workers. I cared for patients who were displaced from their homes by hurricanes. And I looked around and I said, wow, we are dealing with the impacts of climate change today. And those impacts are escalating, so we need to prepare for the future.
I'm Sachet Balsari. I'm an associate professor of emergency medicine at Harvard Medical School and of global health and population at the Harvard School of Public Health. Our main interest in this fellowship is to really prepare physicians for doing what they have always done best, which is advocate for the populations that serve. We have a long history of physicians playing a critical role in changing public opinion about issues that are critical to population health. Think about physicians for human rights, physicians for social responsibility, the landmine ban treaty, nuclear disarmament. These were issues that governments around the world were struggling with, but physicians played a pivotal role in changing public opinion about this.
My name is Katarina Jutsi. I'm an emergency physician and also a climate and human health fellow. I think climate change is impacting everybody, but it's not impacting everybody equally. And I think one of the biggest challenges as healthcare providers, people that are working in this field, is figuring out how do we allocate resources, how do we construct policies in a way that really focuses on people that are most impacted.
My name is Tess Wiskell. I'm an emergency physician at Beth Israel Deaconess Medical Center, and I am a graduate of the fellowship earlier this year in 2024 and now faculty with the fellowship. So I had been an emergency medicine physician and practicing for many years before I came back to do this fellowship. And some of the big reasons that I came back to do the fellowship is one, seeing the impacts of environmental changes to my patients, and another was seeing the impacts of climate change to my friends and family. I grew up in Canada and California out west, and I had friends and family that were impacted by wildfires, not just the smoke, but also being evacuated from their homes and losing their homes and livelihoods. I think as physicians, we have a special role because we're able to interact day to day with patients and see the front lines of what's happening with climate change.
What I love about the structure of our fellowship is that it opens up so many doors. It exposes you to so many interesting people that are doing interesting work, that are in the cutting edge of their field. And I think that really provides the right environment to find what you like to do, learn from people that are doing incredible work, and kind of find your way, whatever the niche is.
I think there's a lot of different excitement about what we can do in climate and health in this fellowship, and there's a lot of different ideas floating around, and everybody's very collegial about wanting to help you make your idea move to the next level.
The reason this fellowship is anchored in emergency medicine is for decades now in this country, emergency medicine has been the social safety net for our health system. We're on the front lines. We're the barometer that sees what's happening in the community.
So at COP27 in Egypt, I was invited to speak on a panel about the wildfire work I was doing. The Climate and Human Health Fellowship empowered me to be at the UN climate change conferences and have a seat at the table and a voice at the table.
One of the projects that I'm working on that I'm very excited about is looking at how temperature and air pollution impact cardiac arrest out of the hospital. We know that temperature and air pollution drive a lot of worsening of medical conditions, and we're interested in how that impacts cardiac arrest specifically.
Where do fellows go after fellowship? There are a lot of opportunities. Some of our fellows have gone on to roles in academic medicine, where they are focused on research, education, and in some cases, developing policy recommendations. Other fellows have gone on to work in public health roles or in ministries of health, where they are actually directly engaged in the policymaking process as it relates to climate change and health.
Just as in the past, we've seen physicians lead and shape public opinion on matters that are critical for population health. That kind of white coat diplomacy is what is required here at the intersection of climate change and health.
As an emergency physician, I see myself as a provider that is trained to address emergencies, and I see the climate crisis as a health emergency. The more people that are involved in this discussion and advocating and moving the field in the right direction, the better. I would say don't be afraid to take that leap of faith. The impact that you can have is massive.